So last week a lovely 26-year-old came into my clinic and the only question she had for me was, "Doctor, will I get these ugly stretch marks and how do I get rid of them?" So let me give you the news, good or bad, the way you perceive it. Almost every pregnant woman is going to get stretch marks. Stretch marks come because our abdomen expands at such a rapid rate during our pregnancy. Imagine you gain almost 20 to 30 pounds in just 9 months. So the skin is trying to keep up with the growth, and the elastin, which is what provides the elasticity to the skin, tends to sometimes become a little stretched and cause marks. And this elastin is very difficult to regenerate, which is why these stretch marks tend to remain even after the pregnancy gets over. However, let me also reassure you that a lot of women, a growing tribe today in fact, are quite happy to embrace these stretch marks as part of their pregnancy, and indeed in fact wear them on their sleeve as a badge of honor. However, if stretch marks do bother you the way it bothered me when I got pregnant, there are solutions that you can employ, and the simplest solution that you can do is start using a very good moisturizer right from the early stages of your pregnancy, but definitely starting from your second trimester. It is also true that research is increasing on stretch marks every day, and there are some ingredients which are proven to prevent them, such as vitamin E in your creams, or even the time tested humble coconut oil that is used all the time for massages. If your stretch marks are darker, as they tend to be in fairer women, or much lighter than your skin color, as they tend to be in darker women, do go to your dermatologist, who may be able to prescribe something to help you. But apart from stretch marks, there are two other conditions that women really get bothered with during pregnancy. The second condition is a generalized darkening of the skin, which could also sometimes get localized on your face, and it's called as melasma when that happens. Now, melasma is something that comes because of the melanin overproduction in your pregnancy, and it worsens when you expose yourself to the sun. So my first advice to you is start using a very good sunscreen. If you're confused about which sunscreen is safe for you, do talk to your dermatologist. You must also know that other parts of your body which are already dark to begin with, like your abdomen, your breast and nipple area, etc., can also get darker and darker. And using a very good moisturizer, again with vitamin E in it, or even some essential oils, can help to lighten the skin. The third one, which to me is the most important because it really bothers women and prevents them from sleeping well, is intense dryness and itching all over the body, and this afflicts most women in their last trimester of pregnancy. Again, the area where you see it the most is the abdomen, because your abdomen is really stretching, but you also tend to get it sometimes all over the body, on your elbows, your knees, your back. Do invest in a very, very good moisturizing lotion. Nowadays you get a plethora of choices. My only advice to you is invest in a lotion without a perfume, because then your chances of getting any allergies to perfume are much lesser. Some women, however, do tend to get a more specific condition in their abdomen, which is itching with red, angry looking patches. This is a skin condition which requires treatment, so do visit your dermatologist immediately. Keep watching this space on more updates on skincare and pregnancy, and do follow me on both Facebook and Instagram as Dr. Aparna S.